Hello and welcome back to our channel. Before we begin, don't forget to subscribe, hit the like button, and turn on notifications so you never miss our health tips. And if you find today's video useful, share it with friends and family. It really helps support the channel and keeps us motivated to bring you more valuable content. Today, we're talking about a very important subject. 5 medical tests you should avoid after 60 that may harm you more than heal. As we get older, medical care becomes a bigger part of our lives. But sometimes, more tests don't always mean better health. In fact, some procedures may bring unnecessary risks, stress, or even harm. So if you or your loved ones are over 60, make sure to watch until the end, because you'll learn which tests may not be as helpful as you think, and what you should consider instead. 1. Full body CT scans. First, let's talk about radiation. A CT scan exposes you to a much higher dose of radiation compared to a regular X-ray. In fact, a single full-body CT can expose you to as much radiation as hundreds of chest X-rays combined. And repeated exposure over time may increase the risk of developing cancer, particularly in older adults whose cells repair more slowly. Second, there's the problem of incidental findings. CT scans are so detailed that they often pick up tiny spots, shadows, or nodules in the lungs, liver, kidneys, or other organs. Most of these are harmless. They could be small scars, benign growths, or age-related changes. But once they're found, doctors usually have to investigate further. That means more tests, more scans, sometimes invasive procedures like biopsies. And often, all of this turns out to be unnecessary because the problem wasn't dangerous in the first place. This leads to what's called the cascade effect. You start with a test that seems harmless, but one finding leads to another test, and another, until you're dealing with stress, costs, and possibly treatments that carry real risks. Third, there's the emotional toll. Being told we found something unusual is frightening, even if it's likely nothing. Many people end up living with weeks or months of anxiety waiting for follow-up results. That kind of stress can affect sleep, mood, and overall health, sometimes more than the original finding ever would. And finally, the cost. Full-body CT scans are rarely covered by insurance unless there's a medical reason. For many, they can cost hundreds or even thousands of dollars. Money that could be better spent on proven preventive care, healthier food, or physical activity. So what's the alternative? Instead of getting scanned, just to be safe, focus on symptom-driven testing. That means if you have a persistent cough, chest pain, unexplained weight loss, or other concerning symptoms, then a doctor may order a CT scan targeted to that area. This way, the benefits outweigh the risks. Many people believe that getting a full-body CT scan is the ultimate way to check for hidden problems. Sounds smart, right? But here's the truth. High radiation exposure can increase the risk of developing cancer over time. These scans often find incidental findings, small spots or shadows that are usually harmless but cause worry. What happens next? More tests, biopsies, and even surgeries that may not be necessary. For people over 60, these risks outweigh the benefits, especially if you don't have symptoms. Instead, focus on regular checkups and symptom-based testing. 2. PSA Test for men. The PSA test, or prostate-specific antigen test, is one of the most commonly performed blood tests for older men. Doctors often recommend it to check for prostate cancer, and at first it sounds like a simple, safe way to stay protected. After all, it's just a blood test. What harm could it do? But the reality is more complicated, especially after the age of 60. First, let's understand what the test measures. PSA is a protein produced by both normal and cancerous prostate cells. If the levels are high, it might mean cancer, but it could also mean something far less dangerous, like an infection, an enlarged prostate, or even the natural aging process. In fact, many men over 60 will have higher PSA levels simply because of benign prostate enlargement, not cancer. This leads us to the first major problem: false positives. A high PSA result often triggers fear, and doctors usually recommend further testing. That often means biopsies, where needles are inserted into the prostate to collect tissue samples. Biopsies are not harmless. They can cause bleeding, infections, and significant discomfort. And in many cases, the biopsy shows that there was no dangerous cancer at all. Second, even when prostate cancer is found, it may not be life-threatening. Many prostate cancers grow so slowly that they would never cause symptoms or shorten a man's life. But once cancer is detected, most patients and doctors feel pressured to treat it aggressively. That can lead to surgery or radiation, both of which carry serious risks. Urinary incontinence, loss of bladder control, which can deeply affect daily life. Erectile dysfunction, a common side effect after surgery or radiation. Emotional stress and lower quality of life. So in many cases, men are being treated for cancers that would never have harmed them, but the treatments themselves end up reducing their quality of life. The PSA test is often recommended for men to detect prostate cancer, but after 60, the picture changes. The test is not very accurate. It can give false positives, suggesting cancer when there is none. This often leads to unnecessary biopsies, treatments, and even surgeries. These procedures carry risks like incontinence and sexual dysfunction. Experts say that if you're over 60 and don't have symptoms, routine PSA testing may cause more harm than good. Instead, discuss with your doctor if testing is truly necessary for your individual case. 3. Mammograms after a certain age. For decades, mammograms have been promoted as one of the best tools for saving women's lives. And for many women in their 40s and 50s, this is absolutely true. Detecting breast cancer early can make treatment simpler and survival much more likely. But when we talk about women over 60 or 65, the situation becomes more complex. The question is not just, can mammograms find cancer? But rather, does finding that cancer actually improve health and longevity at this stage of life? Let's look at the key issues. 1. Overdiagnosis. Mammograms are extremely sensitive. They can detect very tiny tumors, some of which grow so slowly that they would never cause symptoms, spread, or threaten a woman's life. This is what doctors call overdiagnosis. The problem is that once cancer is detected, it's almost always treated, whether it was dangerous or not. That means surgery, radiation, and sometimes chemotherapy for cancers that would have remained harmless. In older women, who may have other health conditions, these treatments can cause more suffering than the cancer itself ever would have. 2. Overtreatment and side effects. Treatment for breast cancer is not simple. For example, surgery can be stressful for the body, with longer healing times and higher complication risks after 60. Radiation therapy can affect heart and lung tissue, especially in older women. Chemotherapy can weaken the immune system, increase fatigue, and reduce quality of life. So the big question becomes, was all this treatment necessary? In many cases, the answer is number 3. False positives. Another major issue is false positives. A mammogram might show a shadow or an irregularity that looks suspicious but isn't cancer at all. For older women, this often means more imaging, painful biopsies, weeks of stress, and emotional strain, only to eventually learn there was nothing wrong. 4. Shifting balance of risk and benefit. For a 45-year-old woman, early detection can save decades of life. But for a 70-year-old woman, the calculation is different. If she has other chronic conditions, the likelihood of a small, slow-growing breast cancer shortening her life is often very low. At that point, the harms of screening, overdiagnosis, overtreatment, anxiety, may outweigh the benefits. That's why many health experts and organizations suggest scaling back or even stopping routine mammograms after 70 to 75, unless a woman is in excellent health and has strong risk factors, like a family history of breast cancer or genetic markers such as BRCA1 or BRCA2. 5. Smarter alternatives. So what should women do instead? Focus on self-awareness. Knowing the normal look and feel of your breasts and reporting any changes to a doctor is often enough. Have personalized discussions with your doctor about your specific risk profile. Consider less frequent mammograms, rather than annual ones, if you and your doctor agree screening still makes sense. For women, mammograms can be life-saving at younger ages. But after 60 or 65, the benefits begin to decline, and the harms increase. Overdiagnosis is common. Many detected tumors are so slow-growing they would never cause harm in a woman's lifetime. So why is this a problem? Because once cancer is detected, it's almost always treated. That can mean surgery, radiation, or chemotherapy. And for many older women, these treatments come with serious downsides. Surgery carries risks of infection, complications, and longer recovery times with age. Radiation therapy can cause fatigue, skin problems, and heart or lung issues in some cases. Chemotherapy can be especially harsh, leading to nausea, weakness, hair loss, and immune system suppression. All of this may be unnecessary if the cancer would never have caused harm in the first place. Another issue is false positives. Mammograms sometimes show something suspicious that isn't cancer at all. This can lead to follow-up imaging, painful biopsies, and weeks of fear, only to find out that nothing was wrong. For women in their 60s and beyond, these false alarms can create enormous emotional stress. Now, this doesn't mean mammograms should be completely abandoned after 60. For women who are healthy, active, and have a strong family history of breast cancer, screening may still offer benefits. But the key is that it should not be automatic. Instead, it should be based on individual health status and risk factors. This can lead to unnecessary surgeries, chemotherapy, or radiation. The procedure itself can also be stressful and emotionally draining. That doesn't mean mammograms should never be done, but screening should be based on your health status, family history, and doctor's advice. 4. Colonoscopy for colon cancer screening. Colonoscopy is a powerful tool for detecting colon cancer, but after 60, especially closer to 70 or 75, it may not always be worth the risks. The procedure requires sedation, which can be risky for older adults. There's a chance of intestinal perforation or heavy bleeding. If you've had clear results in the past, continuing regular colonoscopies may bring little benefit. Instead, talk to your doctor about less invasive options, like stool-based tests, which may be safer and more practical. 5. Bone density tests, DEXA scans, too often. At first glance, it seems logical to get this test done regularly, especially after 60. But here's the key point. Doing bone density scans too often may cause more harm than good. 1. Natural bone changes with age. After 60, bone density naturally decreases for almost everyone. But this doesn't always mean you need medication. A yearly scan often just shows what we already know. Bones are getting a little thinner with age. This information rarely changes treatment, but it can lead to unnecessary worry. 2. Risk of overtreatment. When doctors see declining numbers on repeated scans, they may recommend medications, sometimes too early or too aggressively. Drugs for osteoporosis can be helpful, but they also carry side effects. Digestive problems such as nausea or acid reflux. Jaw osteonecrosis, a rare but serious condition where jawbone tissue begins to die. Unusual fractures, ironically, in some people taking certain bone drugs long-term, so frequent scanning can push people into treatments they may not actually need. 3. Emotional impact. Seeing bone density scores get worse year after year can create fear, even if the decline is mild and expected with aging. Many older adults start to worry unnecessarily about breaking a bone, limiting their activity out of fear. Ironically, this lack of movement can make bones weaker. 4. How often is enough? Experts generally agree that retesting every 2 to 5 years is sufficient, unless there are specific health changes, fractures, or high-risk conditions. Doing a scan every year adds radiation exposure, costs, and stress without giving much new information. Yes, osteoporosis is a concern after 60, but doing bone density tests too frequently may not help. Bone density naturally decreases with age, but testing every year rarely changes treatment. Overtesting may lead to unnecessary medication with side effects like digestive issues or jaw problems. In many cases, lifestyle changes like exercise, calcium, and vitamin D have a bigger impact than repeated scans. Experts suggest that once every few years is usually enough, unless there are specific risk factors. So let's quickly recap the 5 medical tests you should avoid after 60. 1. Full-body CT scans. High radiation. Too many false alarms. 2. PSA Test. Can lead to unnecessary, risky procedures. 3. Mammograms after a certain age. More harm than benefit in some cases. 4. Colonoscopy after repeated clear results. Sedation and procedure risks. 5. Too frequent bone density scans. Often unnecessary. Remember, the key is not to skip medical care, but to make it smarter. The best decisions are made when you and your doctor look at your personal health, history, and risk factors. So before agreeing to any test, always ask, will this test actually improve my health, or just add more worry? If you found this video helpful, don't forget to give it a thumbs up, leave a comment with your thoughts or experiences, and subscribe for more health insights. Your engagement really helps us grow and reach more people who need this information. And remember, good health after 60 is not about doing every test, but about doing the right ones. Thanks for watching, and I'll see you in the next video.